My name is Dr. Joe Griffin. I'm here at Cornerstone Dental Arts, and I've been here since June of 1999, going on 17 years. I'm born and bred here in Knoxville, Tennessee, and went to Bearden High School, UT, and came back here and started practicing in June of 1999. Cornerstone Dental Arts was started in 1988 by four original founders, Jim McKinney, Dan Anderson, Bill Morgan, and Fred Woolwine. They met together for 2 years to create the concept that is Cornerstone. It was more of a comprehensive, probably a holistic approach, I would say, about biocompatibility of materials, different techniques and technologies that weren't mainstream dentistry at the time. One of the things we do at Cornerstone is we look at materials that we put into the body. And it's traditionally been called biocompatibility, but basically it's materials that aren't toxic to the body. And so we're looking at materials that when we put into the body, and once they're set, that they're inert, that they don't change. There's a lot of discussion and fear sometimes by the public that mercury fillings become toxic. The reality is we don't know for sure how it affects each individual, but we do know that mercury, for example, is toxic. And so the last place we want to put it is in the mouth. And so we're looking for other materials, ceramics, composite materials. There are certain metals that we can certainly use in the mouth that are not causing systemic disease or systemic issue to the patient. Dentistry is evolving very rapidly, and technology it's sort of like you can imagine your own home computer. You buy it, and in about 6 months, it's obsolete. Dental technology is not too dissimilar, so we have to stay on the cutting edge of technology. We have an in-office CT machine, so instead of going to the hospital, it's called cone beam CT here. We also have the CEREC, C-E-R-E-C, CEREC system, and that allows us to fabricate crowns and different restorations for teeth in one office visit. It allows us, and it's all digital, so the days of impressions and molds and a lot of the bad tasting things that patients don't like is really becoming obsolete. So, and the accuracy of the technology, when we're able to use a digital camera to create our image and create our impression and then design with the computer, design the restoration, we have extreme quality control because it's being made right here. And also because it's microns of differences with the computer versus impression material that expands and contracts and has a lot of differences and variances in it. It's way more accurate, and we think that the restorations, and now that the literature proves, being 20 years old in the CAD/CAM industry, the literature proves that it's a better restoration long-term for the patient. So at Cornerstone, we have 4 individual dentists, and that gives us the ability to really find our niche and what we are passionate about. And my passion is IV sedation, dentistry, and more importantly, dental implants and any surgery that's associated with dental implants. And so that means removing the tooth, grafting the area, and putting implants in. Also for folks that are missing multiple teeth or all of their teeth, we can put implants in, and we can attach their dentures to it, either screw in or snap ins, whatever the patient prefers. And really it just restores smile, it restores the chewing efficiency, it restores confidence. I think implants have really come a long way since they were started in about 1959. It's changed the way we practice dentistry because it is a significant option that we have now. As opposed to bridges and partials, we can restore with almost as natural as you can get, natural teeth. And with dental implants, we do have the opportunity here at Cornerstone to do it all under one roof. We can do the pre-surgery phase, the surgical phase, and also the final restorative phase. All can be done here at Cornerstone. Along with doing implants, one of the things that we do at Cornerstone on my team is we teach a lot of dentists around the country. We travel to lots of areas to teach, but we also have a teaching institution here in our facility. So we have doctors that bring their patients and their staff to our office, and we perform the surgeries live on their patients. So rather than learning just by a textbook or a PowerPoint slide, we actually teach other dentists hands-on how to do the procedures. And what teaching does is it's caused me to be on my game. It's caused us to really focus and to really be a master of the craft. Because if you're going to teach it, you better know what you're teaching. The Cornerstone Covenant, for us, it's our word to our patients. It's our commitment to our patients. It's what we want our patients to experience. It's what we want them to gain trust in us. And I think by saying it, and especially by putting it in print for our patients to see, it really holds us accountable. And we've signed it. All of the partners have signed this agreement. It is really what we stand on and how we treat our patients, and we really want our patients to be very aware of it. It's published in our lobby so that the patients read it, and really so they can hold us accountable to it. It's more than just our word. It's really a pledge. It is a covenant. It's a covenant to our patients. It says, this is who we are, and this is what we want you to experience here at Cornerstone. So we have a lot of information on our website at whatasmile.com. We have lots of blog entries. A lot of the information that we talk about, we explain in depth on our website. We'd love to have you check it out, look at it. You can also make an appointment directly through the website, and we'd love to have you.